I, Babatunde Osotimehin, solemnly declare and promise to exercise.
Born on the 6th of February 1949, Professor Babatunde Osotimehin was a Nigerian physician who served as Minister of Health in 2008 under the administration of former President Umaru Musa Yar'Adua. Described as a global leader in public health, Professor Osotimehin was a stickler for women and youth empowerment, with a focus on promoting human rights in population and development. Until his death, he was the Executive Director of the United Nations Population Fund, UNFPA.
He left a good legacy as a father for the children. He was a very humble man, very respectful, and very hardworking. Very focused, very visionary, very problem-solving oriented, and he has strong faith in God. For us, my children and I, he was our rock, he was our provider, our protector, our guide, and in many ways, he was just always there for us. Well, 2 years after his passed, the children and I actually feel worse about his departure. We feel worse now than we did when he passed. Because of course, you do not really appreciate the worth of somebody who is always around. But when the person ceases to be around, you begin to see the gaps that only God can fill. But nevertheless, we are comforted, greatly comforted, by his achievements, by the recognition he was given, especially during the funeral, not just in this country, but internationally. And that comforts us a lot, that he lived for a purpose, he made an impact, and his achievements were recognized. And the main focus of what I understand by what he did, even based on discussions we've had with him in the house at various times, is that he was very much interested in the welfare of women, adolescents, girls, the youth generally, and of course pregnant women and babies. And it's interesting that his legacy to us is multifaceted.
Osotimehin's interests were youth and gender, and he advocated reproductive health and reproductive rights, particularly within the context of the HIV epidemic. His professional background in health and medicine helped him advance Nigeria's health sector. Upon moving into his second term as the Executive Director of the UNFPA in 2015, Professor Osotimehin introduced new reforms that increased the effectiveness of the United Nations agency and outlined plans to improve the lives of women, adolescents, and the youth around the world, with a focus on maternal health and family planning.
We must develop zero tolerance to women dying given life.
Professor Osotimehin completed his medical studies at the University of Ibadan, southwest Nigeria, in 1972. In 1979, he moved to the United Kingdom for a doctorate in medicine at the University of Birmingham. He was thereafter named professor at the University of Ibadan in 1980. He rose through the ranks to become the provost of the College of Medicine at Ibadan.
And as a West person once said, if you want to go fast, go alone. But if you want to go far, go together. Let me count on you to make your voices heard in this enterprise.
It's a garden of family members, friends, colleagues, the academia and medical experts at the Otunba Subomi Balogun Conference Center, University of Ibadan.
Let's welcome Mama Prof Osotimehin. You are welcome, ma'am.
They're here to grace the first edition of the Professor Babatunde Osotimehin National Reproductive Health Legacy Forum.
The celebration of the worthy contributions of Prof Osotimehin to the quality of life of women, children, and family members. And I think that if you look at his trajectory in life of being a chemical pathologist, who transformed into a reproductive health specialist and expert and consultant, an advocate and practitioner and motivator, you know that indeed it was like a calling for him to have veered into reproductive health. I want to remember that Prof Osotimehin started his foray into reproductive health far, far way back, when many line practitioners who are either obstetricians, gynecologists, public health practitioners themselves had not soaked themselves in it. Way back in before late 1990s, when he led us to establish social science and reproductive health network.
This event is of great national importance. It's an event that is meant to accomplish two things, two interrelated things. On the one hand, it is to celebrate a great Nigerian hero and a global icon in the field of sexual and reproductive health, and that's in person of Professor Babatunde Osotimehin, who, as we know, was a former provost of the College of Medicine in University of Ibadan, former Director General of our national agency for the control of AIDS, former Minister of Health in Nigeria. That is a Nigerian champion, and he became the head of the executive director of United Nations Population Fund. That's the global icon. So this event is to celebrate a global icon. And one of the reasons why that is important is the fact that excellence only thrives when it is recognized, when it is celebrated, when it is rewarded. So as you celebrate people like you, other people, particularly young people, get inspiration about life. So that's one of the things, to celebrate him. He's a Nigerian who has done well. Let's celebrate him at home. Let's show you that we are proud of our home. That's one purpose. The second purpose is to advance the agenda, the unfinished agenda, for which Prof Babatunde Osotimehin lived and committed himself to. And that's the agenda of family planning, adolescent health, in the broad context of sexual and reproductive health and rights. So it is a forum that enables us to remember his legacy and to sustain that legacy by bringing together a body of practitioners and scholars to look at the same issue around family planning and how Nigeria can advance. So those are the two interrelated purposes of this forum.
The event was organized by the Academy for Health Development Ahead in collaboration with the Partnership for Advocacy in Child and Family Health at Scale, Paaneah Foundation, and College of Medicine, University of Ibadan. The first annual Legacy Forum is in honor of Professor Babatunde Osotimehin, an advocate for rights of women, girls, and youths around the world.
dRPC has been a very strong partner and advocate, together with people like Professor Babatunde Osotimehin and several other frontline advocacy groups in the field of not just development in general, but also the health issues that directly and indirectly affect the potentials for development and growth. We are a center committed to mainstreaming the vulnerable and the marginalized in our communities and giving them the voice and making them part and parcel of the process of development. So if you like, this is all about participatory development processes. And we regard health issues as very key, to participation. Now, Professor Osotimehin was in the forefront of a multidisciplinary approach to issues of population control and family planning. And the entry point for him was the fact that our country is in the danger of a population burst that is not matched by the kinds of resources and development planning processes that we have as a country.
Babatunde Osotimehin happens to be one of the greatest icons Nigeria has produced in the reproductive health sector. And his own is so important and interesting that his background in terms of training wasn't actually gynecology. He was a chem-paths professor, transformed to be one of the greatest giants in reproductive health, rising up to the level of the United Nations Population for Fund Activities, UNFPA. So it's a very heartwarming thing that we have found a way to immortalize his name, because I guess this lecture will be coming up every year, and that's a way in keeping his name up there. His body has died, but his name shall not die.
But because it makes a lot of sense, man. Jam your hands
A hall
together for
filled
our
with
once again.
scholars from the various fields of medicine and reproductive health. The lecture and discuss, focusing on family planning, dominate the gathering.
Otolore can continue to salvage reproductive health.
The theme of this Maiden Legacy Forum is meeting family planning's 2020 goal, whither Nigeria. With an applause from scholars in the room, Professor Emmanuel Otolori takes the podium to give his lecture on Nigeria's commitment to the Family Planning 2020 program and the progress made so far.
We were a signatory to numerous commitments made in 2012 as the FP 2020 conference in London. And these commitments were revised in 2017. And the commitments were excellent. If fully implemented, they will get us to where we want to be, which is to raise the contraceptive prevalence rate of people of reproductive age in this country, and that will slow down our overall population growth rate and allow us to better manage our resources. But unfortunately, as good as these policies and commitments are, we have not fully met them. And because we have not fully met them, we are lagging behind many other countries. And our population continues to expand rapidly, much below, much above our economic growth rate. So we are compounding our problem of insufficiency in every sector. We don't have sufficiency in education, we don't have sufficiency in health, we don't have sufficiency in food, we don't have sufficiency in human resources, and all of this, we don't have enough jobs for people that we are training. And rather than finding solutions to all of this, we're having more children and sending many to more schools. We are building more schools with the same budget. So the quality of education is dropping, the quality of healthcare is dropping, because we can't meet the demand of the population that we have.
If you look at the issue of reproductive health and family planning in particular, 3 things stood out in this presentation of today. Education, first and foremost, rural living, and also wealth. The poorer you are, the less likely you are to use family planning. The less educated you are, the more unlikely you are to use family planning. The more you live in rural areas, the less likely you are to use family planning. So these 3 issues stood, and you can see that if you look at poverty, if you look at literacy rate, what is the improvement over the many years? There are a lot of projects, a lot of work that the governments have done. When I say governments, I mean the federal government and the state government that are doing to improve access to family planning. But they are not enough, because the people that will use the services are still not accepting the services. Why? Because they don't have this awareness, they don't realize the potential, the importance of family planning, first of all. Because there's no point bringing children that you cannot cater for.
Until every girl, every woman, everybody wherever they may be can access reproductive health service, especially family planning, the work is not done. The words of Professor Osotimehin, here quoted by Professor Emmanuel Otolori, will remind his audience of the high hopes Professor Osotimehin had for Nigeria's health sector.
We have to learn to mitigate and moderate our population growth to our resources. The same thing happens in all the social sector. We don't have enough jobs. instead of saying, let us just create more jobs. The rate at which we can create more jobs is limited by our resources. Our economy is growing at 2%. Our population is growing at 2.6%. Even our economy went negative growth. We are importing rice. We are importing food. We cannot feed ourselves. And yet, people are not embracing family planning. The Asian tiger countries, Thailand, Malaysia, Indonesia, all those countries were at the same level with us 30 years ago. But they have embraced family planning. And because they embrace family planning, their population growth rate has slowed down, so they are able to meet the demand, the social demand of their population. So the quality of life is getting better, life expectancy is getting longer in those countries. We don't have to suffer. We should learn from the experience of those other countries.
Nigeria, Africa's most populous country with a 2019 estimated population of over 200 million people, had in 2017 made a pledge to achieve a usage of modern contraceptive rate of 27% among all women by 2020. Over the years, many developed and developing countries have embraced family planning as a mitigation approach to rapid population growth and as a strategy for the reduction of maternal and newborn mortality. But for Nigeria, reverse is the case, as the demand for resources doubled. Experts say if care is not taken, the poverty index might just get worse than its current state.
Nigeria has not fared well at all. One of the key things is that occasionally, if you're doing well, or you think you're doing well, you do what we call a peer review of other people, other nations around you. I am also the CSO focal point for FP 2020. Just May this year, we were in Addis Ababa, 18 Anglophone countries, looking at issues of the commitments all the governments have made to FP 2020 Global Initiative, which says that by 2020, 69 countries, poorest countries of the world, should be able to make sure additional 120 million women girls have access to family planning that is right-based. While we were in that meeting, and I was meeting here in other countries that we feel that we are far above in everything, in human development, in resources. Their family planning penetration hitting 35%, 40%, 55%. And here we were, right in that meeting, the Nigerian Demographic Health Survey. We got the information. We were just at the lowly 12%. So that means we stayed at 12% for 15 years. So if you tell me what has happened in the past 10 years, absolutely nothing really in terms of the family planning uptake. It's a flat graph. And the reason is very obvious. We have not made a philosophical decision that we are growing our population in a way that it doesn't make sense to us anymore. People are just walking around as if nothing is happening. We are in denial. If you look at all the imperatives of demographic crisis, we have all of them. We are in trouble. All the security challenges we have around the country, the bottom line is the population growth. Our last census was 2006. We were counted to be 140 million. And I can tell you, that estimates is also, that number we are looking at, I feel is even suspect. Our population is growing at the rate of 3.2% every year. So from 2006, we were 140 million. Our population has grown to 2001 million now. We added 61 million people in just 13 years. No plans were made for that huge population. The resources are dwindling. Take, for example, the capital budgets for the Federal Ministry of Health in 2007 compared to the capital budget in 2016. The 2016 capital budget of Federal Ministry of Health was 40% of what we budgeted in 2006 and 2007. And meanwhile, the population had grown by about 58 million. So if you see per capita spending, Even though aggregately, the Naira quantum has increased, but the purchasing value in terms of dollar, it has reduced by 60%. And within that same period, we've added additional 58 million people. That's why Nigeria has one of the poorest health indicators in the world. We rank 187 over 190.
The family needs to understand the value of every child. And every child needs equal opportunity to access education, to access good health care services, to also have a voice. So that girl child is not an exception. So what the government is doing actually is to engage relevant stakeholders, most especially at the family unit, and then also the community at the community level. It is very important for them to understand the value of a girl child, the value of her going to school, the value of her being a mother, and the value of her also giving her own contribution to the society when she graduates or when she works. Or even if she doesn't work, but at least she can also engage in business. It's not only government work, but she can also be engaged in businesses. And she will be able to know her left from her right. She can be able to take decision when it comes. She can also be able to engage if she's married, her husband, and also all members of her family, including the community. So I think the most important thing is to ensure that we enroll our girl child into education, because education is the bedrock of every society. Education is the foundation of every society, and with additional knowledge, the government will have given voice to the girl child.
But with less than a year to the deadline set for the achievement of the Family Planning 2020 goal, Professor Osotimehin's colleagues and friends are taking an even bigger step. The event also marked the launch of a 152-page journal on medicine containing 19 articles.
Copy, sorry. Guys. Thank you. The cover is beautifully designed.
This year we have looked at the issue about family planning, meeting that goal as a whole. And if you go back to today's lecture, one of the things the lecturer said to us that there are three elements that you particularly need to look at, or three subgroups. One, men and their involvement. Two, women, and how do you continue to support them on finishing the agenda. And third, the young people. The agenda for next year is going to be adolescent, young people, and family planning. How well and where are we going? I can tell you that is it, because there are two things that connect the dream that Prof Osotimehin had. One is the women, okay, and the second arm is young people. So this year we've done for women. Next year we're going to look at young people.
Professor Osotimehin died in Harrison, New York, a suburb of Manhattan, on June 4, 2017, at the age of 68.